in your bargaining. You know, Sarah was being kind. I'm old. I started this, oh gosh, 1994. What would that make it? I don't even know. 30 years ago or so. And that was when they cut, essentially in the 90s, they cut 18,900 hospital beds. Have those hospital beds ever reopened? No. Even though the population has grown dramatically. In fact, I remember many years ago being right here, and Joshua Flewelling, who died in an ambulance, being redirected from hospital to hospital to hospital, was being mourned, and we were protesting the hospital cuts then. For my entire, and I should say a hospital bed is a piece of furniture. When we talk about 18,900 hospital beds cut and never replaced in Ontario, we're talking about beds that are staffed in an operation, staffed by you, health professionals, nurses, support staff. You know, you could run a hospital for months without the CEO and you'd never notice. But you take away the health professionals and no patient would live. In fact, you know, you're absolutely vital. And this system has continued for these 30 years by stretching the healthcare workers ever more and more and more. You've held this system together. You've held public Medicare together without the political support, without the resource support that you need. And lest you think there isn't enough money. This year, in the budget they just released, so okay, Ontario has the fewest hospital beds left, staffed in an operation of any province in the country. We fund our hospitals at the lowest rate in Canada. Guess what we have as a contingency this year in the budget? $2.8 billion. Guess what we have as a reserve? $2 billion. Guess what we have as a slush fund in case private business needs it in this economic crisis? $5 billion. I'm not kidding. So how is it a crisis when it's the private sector? But when our local emergency departments are closing because there are no nurses, when we're closing down ORs because there are no anesthesiologists or anesthesiologist support, when we're closing MRIs and CTs in public hospitals and paying double at the Don Mills, Centric Health for-profit hospital just on the edge of Toronto here, it's not because there's no money, it's because they're doing the plan, and that is to close the public hospital services, privatize them to for-profit staffing agencies and for-profit hospitals and clinics, and for them, the sky's the limit. You are right to demand what's yours. And I'm here to say we are 100% in support of you. Go to it. We hope that you get a great deal for your members. We will add it. And I'm just going to end with this. Sorry, I said the hospital can run without the CEO. I just want to add in this. I love this saying for the health professionals. And without you, your doctor's only guessing. Thank you.